Hey, everybody. This is Kara Crosswhite-Brindle, co-owner and co-founder of the Empowerment Model of Clinical Supervision, representing Supervisionary today. I have a wonderful guest, Erika, with us today, who's going to talk about client boundaries and how to address this as part of our supervision series, our stellar supervision series, actually, because I love things that match and rhyme.
Yeah.
So, Erika, thanks for being here.
Yeah, absolutely. Thanks for asking me.
Yeah, well, I know that this comes up a lot with those of us who do clinical supervision. So before
Mhm.
we jump into it, how about we start with who you are and what you do?
Yep. So, my name is Erika Johnson. I am the owner of Journey to Joy Counseling in Lakewood, Colorado. I'm currently doing teletherapy right now, so no in-person sessions. Had to give up the office earlier this year,
Yeah.
so working through that. I specialize in complex and attachment trauma, substance use, and depression. And I'm EMDR certified, and I'm an NDRIA approved consultant. I am a approved clinical supervisor. And yeah, I work with adult individuals.
Yeah, I would say, and all things powerhouse, and that's why you're here as part of the series because
Yeah.
you're doing a lot of cool stuff.
hmm Yeah.
That's awesome. So, why is supervision part of your arsenal of things that you do?
Mm. I love being able to teach and help, especially like younger, newer clinicians in the field. It's important that we want to have good therapists to help clients, and so I like being a part of that process in all areas. Because I forgot to mention, I'm an LPC and LAC, so in the LPC world, while also in the addiction world.
Yeah, so you have a lot to offer these supervisees that you're working with. Absolutely. And many of the people on this series that are going to join in videos after you are also
mm
approved clinical supervisors. So this ACS credential
mm
we're seeing as that next
mm
level of clinical supervisor.
mm
So obviously I asked you to come in and talk about client boundaries because of a
mm
conversation you and I had in consultation at one point. Can
Yep.
you share with folks why this is important to talk about client boundaries with
mm
supervisees?
hmm Well, I know from personal experience how important it is to have boundaries with clients. That when I was first starting out, I did not have the greatest boundaries and still learning that. And so it led to just that frustration, irritability, burnout. I remember like crying at the end of days, like calling my coworkers.
Mm,
And one day my coworker was like, Erica, you just need to go home. Like, you need to be done for the day. And realizing, like, okay, I'm working harder than my clients and this
mm,
isn't good for my health. And so wanting to help supervisees learn, hopefully early on, how can we set these good, strong, healthy boundaries, especially knowing like with our adult clients, like they're adults. They've been taking care of themselves a heck of a lot longer than they've known us.
yeah.
And that's a good thing. And so it's okay that we protect ourselves so that we can be good therapists for our clients, provide good
Right.
clinical care.
Well, and I love that you started to talk about some of the warning signs. Like you kind of rattled off a few things like irritability and crying at the end of the day and some of the burnout stuff that shows up when the boundaries aren't so healthy. Is there anything else you would have both supervisors and supervisees look for when it comes to boundary violation?
Mm, I would say thinking about like resentment towards clients,
Oh,
dreading going into sessions because I think a lack of boundaries can lead to burnout or
yeah.
compassion fatigue, all of that. We want, of course, like physical boundaries and then really emotional boundaries too. So being able to help supervisees identify the differences between that and just like what's coming up for them like when they're
Yeah.
seeing this client or even it can seem like it's a good thing that they're doing this. I see a lot of times with older supervisees that like maternal type
Mm-hmm.
figure will come out, that rescuing, wanting to save, that type of complex can come out. And so knowing like, yeah, that can be a good thing to maybe have more of a motherly type figure. And if there's not a healthy boundary in place, how will that impact both you and the client?
Right, right. I think that's a really important distinction because it's like the fix its, and then there's that
hmm
caregiving maternal role. I mean, yes, we
hmm
all want to help and we have that little superhero cape that we like to wear, but for what
hmm
reasons? So, kind of being curious about that or questioning that.
hmm Yep, absolutely.
Well, I love what you just described there because it reminds me of I have two clients in my mind that brought up that dread feeling you were talking about, where I'd see them
Mm-hmm.
on the calendar and I just
Yep.
have this sinking feeling of like, oh, because I knew there'd be a lot of work. It was just a lot of trauma. It was really heavy work. And I learned pretty quickly about where to put them on my calendar so that I could actually kind of regroup. So one was right before lunch, so I had a break right after her. And the other was at the end of the day. And so, I think that's something to normalize, is like recognize what's coming up and if that should be something to staff and supervision.
Yep, absolutely. And even too, questioning like, is this the right population for me? Do I need more training or skills or knowledge, or do I really just want to work with a different set of folks who maybe aren't as wearing or tiring on my system?
Yeah, especially when you talk about you have specialties in trauma and substance use. I think those two populations, if we had a full caseload of just that would feel pretty tiring at times. Maybe that's just me.
No, it's true. It's exhausting.
Yeah, so just like recognizing some of those warning signs, but also asking some really good questions about the clients and what's showing up for the supervisee when they are staffing cases, for example.
Yep, absolutely.
Anything else you would recommend supervisors do to have the conversation about boundaries?
I'm always big on like what is happening in the moment in sessions with you. So for supervisees, when they're in session with clients, what's happening in the moment for you? And then outside of that session, being able to be like, okay, what was coming up? And what do I need to do with this? Kind of, we don't want to do therapy with our supervisees. And yet I think it's important that, so recognize like, how are boundaries taught to you? What does that look like? Do you even know what a healthy boundary is, and what comes up for you when you hear that, so they can do their own work and healing in that area, so then they can carry that forward with their clients and teaching their clients healthy boundaries.
Well, I love that it's a lot of open-ended questions for them to be curious about what came up, so it doesn't feel like there's shame, which I never would have thought you would shame your supervisee anyway. But just to have them really like name it out loud. Here's what came up, or this is the part of me that wants to save or fix, or I mean, we're all guilty of that at one point or not in our career.
Absolutely. Yeah.
So I know you mentioned different populations, having people be curious about that. Anything around like the disclosures, because that's the other piece that popped into my head. It's like there are certain clients that, if we actually do our own work, we recognize that we really like our clients, or that we could see ourselves being friends with them if they weren't a client, that kind of gray area. So when it comes to like disclosures and your clinician saying, here, I was telling them a little bit about me, how do you navigate that as a supervisor?
Yeah, absolutely. That's a great question, because it is hard knowing how much do we self-disclose in a session. And so asking myself, asking my supervisees to be like, how will this impact the client in the session? Is this necessary? Because we know there's a power differential between clinician and client. So we want to normalize things and just make us think that we're also a human too. And so whatever we can say and do to help that, with having the healthy boundaries of how much do they need to know, is this a therapeutic working relationship, or is it becoming more of like a friendship now, and like gossiping or talking about things that aren't really relevant to treatment and healing. So talking to them, talking to supervisees about that, and questioning too, that there's not necessarily anything wrong with self-disclosure. Is this, what was your intention of disclosing that? What were you hoping to gain, or for the client to learn? Or because if it's about you, well, it's maybe not the best approach. We don't want it to be
a yellow flag.
Like,
let's look at this deeper. Yeah, absolutely. Well, and there's just so many ideas popping in my head as you're talking, because I just remember doing to do all this work. Sometimes it's after the fact, like you've self-disclosed, and then you feel that kind of feeling after, of like, that didn't feel quite right, or didn't land correctly, or then you question, would I have disclosed this to any of my clients? That was what I was taught. And I feel like that would be another skill for our viewers, is asking ourselves, would I share that same information with all of my caseload? And if the answer is no, then one, be curious about it. But two, what is it about that client that made you think it was fine to share with them? One of my clients lovingly calls it coffee shop talk. If we're at coffee shop talk, they're not in therapy. They could do that with a friend. And it's also that dreaded maintenance that you and I have bonded over. Like, we don't like maintenance. Like, once you've done your work, like, head on out.
Yes, exactly. You can do this.
So if it gets too conversational with clients, then maybe that is also something to keep track of.
Yeah, absolutely.
Awesome. Well, there's probably a mantra in here somewhere of something that people can ask themselves again and again when it comes to client boundaries. If you could sum it up in one sentence, what would you have them ask themselves?
Oh, that's a good question.
I know I kind of threw that at
Yeah,
you.
yeah. I'm trying to think. There's so many good things. Like I was thinking, oh goodness, what is my intent with this? Or even just a good question of how am I doing right now? Because I think that's a good indicator of what's going on in your world. If you have poor boundaries or a lack of boundaries, you're probably going to be feeling more tired, frantic, worn out. Because I know working with supervisees that they're telling me that, oh, I'm talking with the client. I met with the client earlier in the day and it didn't end as well. And so I'm so concerned that I'm gonna call them while my kid is, well, when I'm should be off work hanging out with my kid, and then it's a question of, okay, what's coming up for you right now? Like, how are you overall doing? And it
Yeah, the
doesn't sound like,
urgency. Mm-hmm.
yeah, it doesn't sound like
Yeah.
you're doing so well right now.
Well, and I think I want to call back something you said earlier, which is not working harder than our clients. And that was a
Mm-hmm.
mantra that was instilled in me by my supervisor to be
Yeah.
like, hey, you're working harder than them. So that was kind of her way of like waving a hand, being like, pay attention.
Mm-hmm.
Whether it was, her other phrase was watch the train wreck sometimes, which is
Mm-hmm.
hard. It's hard to hear. It's
Yeah.
hard for me to say that on a video.
Yeah.
But, working with a population that had a lot of crises, just that sometimes, it isn't our job to rescue. Sometimes it's to help them recover after.
Mm-hmm.
Obviously, safety concerns are the exception, but
Yes.
not go into the savior or fix it mode. And
Yep.
so she's like,
Yep.
sometimes you gotta watch them wreck. It's like,
Yep.
ooh,
Absolutely.
I
Mm-hmm.
still have that reaction in my chest, like, ah,
No, no, it's hard. It's uncomfortable. And I was
yeah,
thinking as you're saying that, a good mantra that I always remind myself too is that they are adults. I work with adults, so they
yeah.
are adults. They've done their life a lot
I like
longer
that
on
one.
their own without me, so they will be okay.
Yes, they
Besides the
did something
crisis.
before you. We'll have something after you.
Yep, yep. Hmm.
Awesome. Well, I think there's a lot of good content here for people who are trying to figure out their own boundaries, including those warning signs we've identified
Yeah.
today, but also some of those questions that they can ask themselves or as supervisors ask the
Hmm.
supervisee just to do a
Hmm.
little bit of deeper work. Obviously, this the tip of the iceberg. I know that you do this really well. That's why I asked you to come on this video.
Hmm.
If people want to talk to you about this further, where can they find you?
Yeah. They can email me, Erika at journeytojoycounseling.org. That's all spelled out, and it's Erika with a C. My website is journeytojoycounseling.org. Those are probably the two best main ways.
Awesome. Well, I'll make sure to include your website here below the video so it's really
Oh,
easy for people to reach out.
hmm.
And thank you
Yeah,
again for your expertise on boundaries. I know this is an
yeah.
ongoing challenge, an ongoing
Hmm.
conversation, and I hope this video is going to help a bunch of people.
Yes, me too. Thank you again for asking me.
Absolutely. Viewers,
Mhm.
stay tuned for more of the Stellar Supervision series. We'll see you next time.